Hi everyone. So my case study is going to be on a patient with the initials of MF, so that's what I'm going to go with. So MF is a 44-year-old male with a history of chronic back pain and gout presenting to the office today just for a wellness visit. He has no complaints at this visit and is okay with getting labs done today since he is fasting, so his chief complaint would be just a wellness visit. His objective information is that his weight is 195, BMI is 26.47, so normal, and blood pressure is 100 over 78. During his assessment, I saw no signs of distress at all. His heart has a normal rhythm with no murmurs upon auscultation, and his lungs were clear, regular, unlabored, also on auscultation and assessment. Strength is appropriate with no signs of weakening. An assessment of the tympanic membrane showed some impacted cerumen. No flare-ups of the gout noticed during this assessment, and he said that he wasn't having any right now either. No further abnormalities noticed in all other symptoms, so he was a pretty healthy guy. So the assessment part, what I'm going to do for my primary diagnosis is the impacted cerumen. The differentials, I'm going to go ahead and do the gout unspecified, just because right now he's not having a flare-up, but it could have been, and yeah, same with the chronic back pain, I'm going to use that as a differential as well. But yeah, since he's not having any complaints with either of these and no issues right now. So my plan of care, so first of all, because my primary is the impacted cerumen, I'm just going to go ahead and do an ear lavage in the office. I'm going to ask the nurse or the medical assistant to get that done so we can go on to the next patient. But I'm also going to go ahead and order routine labs because it is a wellness visit, which to me include the CBC, the Comprehensive Metabolic Panel, and the lipid panel. And since he does have a history of gout, we're just going to go ahead and order a uric acid to see how that's going. With his history of gout, I did want to make sure that he was educated on foods that can increase his chances of getting gout by increasing his uric acid levels. So I just wanted to make sure that he knew that eating red meats and drinking alcohol were two of the big things that can cause a flare-up. And of course, this was done during the hospital, or the, oh my gosh, holiday weekend, Memorial Day weekend. So of course, burgers and alcohol are like the mainstay for the holiday weekend. So I did warn him about that, but we'll see how that goes. I did say that if he were to have any flare-ups, that he can go ahead and take NSAIDs like ibuprofen, but if that wasn't able or good enough, that he can go ahead and call our office if he needed any other kind of therapy. So then the last thing, since this is a wellness visit, I just want to go ahead and schedule him again for 1 year, just so that we keep up on seeing him every year, his annuals, and at his age, he doesn't need anything right now. As far as screenings go, so everything seemed well, and yeah, he was okay to return in 1 year, and encouraged to call the office if he needed to come in any sooner. Thank you. Bye.